Welcome to the Mind Myself podcast. I'm Esther, and it is my pleasure to be bringing you information about healthcare approaches, health issues, and people's health journey stories, all from the complementary, holistic, and integrative perspectives, helping you become your own best health advocate and helping you make your own informed choices because you matter. Welcome to Mind Myself's Conversations with E. I'm Esther, and the founder and CEO of Mind Myself, and it is my pleasure to welcome back to our podcast, Dr. Vicki Mondloch. Welcome, Vicki.
Thank you so much. It's such a pleasure to be here.
We are so grateful that you are sharing this information with us about so many things, but in particular, the 4 legs of the hormone chair. And just before we get into our conversation today about the thyroid portion of that chair, tell us a little bit about yourself, your passions, and how you ended up with this incredible body of knowledge that you have.
Wow, well, that's quite a lead-in. Thank you so much. Well, I'm an OB-GYN by board certification, did 16 years of traditional OB-GYN, then realized that my going through perimenopause, menopause was the journey that my patients were also going through. And if I didn't know what was going on, they didn't know what was going on. So I made it my personal and professional mission to debunk the actual myths about what hormone challenges are, what are the travels that women travel through, what are the travels men travel through, and what is the importance of not just your female male hormones, but the 4 main hormone groups that make up the foundation of your health. That's really what makes us who we are. And if I can make people 15 to 20 years younger than their stated age, wow, what's wrong with that, right?
Absolutely.
Right. So I took my work and put it into not only research, but published them into 2 books out of 4 that are coming. But the 2 books that I have are for the 2 forgotten women, the adolescent female blossoming, becoming a woman, and for the perimenopausal, menopausal, postmenopausal female, the second forgotten woman. So it's debunking the myths, telling the truths, allowing people to identify the symptoms that they'll run into and find themselves in there, read the research, know the lifestyle recommendations, case studies, but most importantly, in both books, a chapter on how to talk to your doctor. What is the blood work you need to get done? Why is that important? And give yourself the education and advocate for yourself. Give yourself your own voice to talk to your healthcare provider.
I love that. That's one of our vision statements with Mind Myself, which is helping people everywhere, women in particular, to become their own best health advocate. So wonderful tools, and those books and the links to get them will be in the notes for this podcast as well. So today we're talking about thyroid. Can you put thyroid in the context of the legs, the 4 legs of the chair, and then let's jump in.
Well, thank you. And again, the 4 main hormone groups, the foundation of our health. There's the female male, there's the cortisol, your adrenal, thyroid, our metabolism. Gee, that's not important at all, is it? Of course it is. And then your insulin is that 4th leg. So all 4 of those hormone groups are equally important to the balance of that chair, to the foundation of your health.
I love it. And particularly of particular interest to me is thyroid, because that's something I have wrestled with my whole life. So I'm very curious to see what you say to us today. Why is thyroid in particular so important to our overall health?
Well, thyroid is what runs your metabolism. It's whether or not you have a high speed switch or a low speed switch. Some people will say, I'm always sluggish. It must be my thyroid. Well, maybe it is, maybe it isn't. But thyroid is a gland in your neck, and that gland is told its marching orders, so to speak, from a gland in your head called your pituitary. And this pituitary talks to your thyroid. It talks to your adrenals. It talks to your sex organs. So it talks to your hormone groups and tells them what their marching orders are, and things have to be in balance. So the speed at which your body works, that's really important. And for people that live on an ocean or near a coast, most of those people are going to have a higher exposure through seafood that's coming from the sea with iodine, which is one of the major supporters of a thyroid gland. People that are landlocked in the center of a country or far away from a coast may only have fresh water as their source, and their seafood is flown in, but it may not necessarily be wild grown, it may be farm grown. But people that only have freshwater access are usually iodine deficient and therefore have a higher incidence of thyroid issue. Again, that gland in your neck. So if you're uncertain where it is, go to your Adam's apple and actually with your thumb and forefinger of one hand, find your Adam's apple and then just gently hold and swallow. And if as you swallow, you feel the rings of your Adam's apple, your thyroid is normal in size. If you do that maneuver and you do not feel the rings of your Adam's apple, your thyroid is enlarged, which means that it's working harder than it should. If you notice a general enlargement, then your thyroid is very enlarged. And usually that means you better investigate what's going on. If it's nodular or lumpy, that could actually mean autoimmune attack on your thyroid. And that needs to get looked at as to whether or not any of those nodules, which are trying to wall themselves off and protect themselves from attack, what if it is autoimmune, or if there may be something like precancer or cystic or cancer going on in that gland. So
much to think about in terms of thyroid. Now, I know personally, I've had lots of thyroid tests, and sometimes I have to fight. Well, I don't have a doctor right now because in British Columbia, 1 million out of 5 million people don't have medical doctors. So it's hard to get a test done in the first place. But if I were to get a test done or a series of tests, what are the ones you recommend to learn about our functioning of our thyroid?
well, the absolute minimum, and I just say this to say it because it's what most medical doctors will do, is the absolute minimum, which is the TSH, that message from your pituitary to tell your thyroid to go to work. That's the marching orders that are coming to your thyroid. But it doesn't tell you what the thyroid thinks of the marching orders. What if those marching orders are, I don't want to do that today? Then your TSH may reflect that as you're giving it a thumbs up. I don't want to do that. Or it may be eager beaver. Oh my gosh, yes, I'll get right on that. I'll get right on that. And now it's overactive. So you have the underactive when that TSH is higher and out of range. You have that overactive TSH that's going to be very low because it's running at 1,000 miles an hour and it's out of there. So that's your bare minimum, but it doesn't tell you what the thyroid itself is doing. So the rest of the panel is your free T4 and your free FREE T3. What's the difference? Well, your free T4 and free T3 are your bioavailable in your body. So the T4, that free T4, is what your thyroid is actually working with. That's the protein that your thyroid makes and is working with. Your free T3 is T4 that gets converted to T3 and sent out to your body. That's what gives your muscles energy. That's what gives the rest of your body, your brain, the rest of who you are. That's what gives you your quote unquote speed at which you're working. That's where you notice that speed. So that comes usually as a thyroid panel. TSH, free T4 plus free T3. So that is my bare minimum, is those 3 tests as a thyroid panel. Okay, you don't want just the T4 That's your reserve. You want the free T4, your bioavailable. That's what's having your thyroid do the job of making and converting the T4 to T3 to go out to the rest of your body.
Wow. Go ahead.
There are two other tests.
Okay, great.
That when I'm first meeting a patient, I will insist upon doing, and it's whether or not there may be autoimmune thyroid disease going on. And people will look at me at first and go, I've seen my other doc for years and nobody's ever checked me for autoimmune. Why are you suspicious of autoimmune? And it's because autoimmune thyroid is the most common autoimmune disease that the body has. So why wouldn't we look at it, right? Right? So there are two antibodies, and the thyroglobulin antibody will attack your thyroid gland. That's when I talked about nodules.
Mm-hmm.
And think about a fort and an army coming to attack the fort. What do? You line the fort around the top with your gunners, your archers, and you pull up the moat, or the bridge across the moat, because you want to protect your castle, so to speak. Well, that's what your immune system does, is it builds these nodules to protect your thyroid gland from attack. And so that's just a good way to think about it. Your second thyroid antibody is your thyroperoxidase antibody. That's the antibody that actually goes out and attacks your free T3. Well, remember, where is your free T3? In your muscles, in your joints, in the rest of your body. So that's when people will say, I have joint pain, I don't know why. I have muscular pain and I don't know why. Or I have a rash and I get it every time I eat wheat. Whoa, that is your GI tract that's actually disseminating and helping and responding in many cases to what you eat. I'll get to that in a minute. But these are your body's manifestations of T3 all over your body that's getting attacked by that antibody. And so different organ systems are going to give you different messages as to what's going on. I've had people lose eyebrows because of it, or have hair loss because of it, because it'll go after their scalp.
Wow. There's so much to know. We could talk for hours on this one and I wouldn't be bored at all. But let's move on to another question here. How often should we get tested? And if our doctor doesn't, because this has happened to me many times, where my doctor says, oh, we just need the basic one. We don't need, even though you've had thyroid issues and you're on meds, we don't need any other ones except that one test. So how often should we get our tests done for thyroid, and what can we do if our doctor's resistant?
Well, the testing interval, if you're starting off for the first time and you're in normal range, but not optimal range, notice I just shifted the playing field there, then in my book, I would check you again in 6 weeks, because I want you optimal. Every time I would ask a patient, do you want to just be normal or do you want to be optimal? Well, gee, guess what their answer is going to be?
Optimal. Yeah.
Exactly. So if that would require me to work with adding iodine or adding another easy supplement, selenium, to be naturally supportive of a thyroid gland without using medication, I would still want to see that result in 6 weeks, which is the usual amount of time for a body to respond to something that you've changed in its environment. Okay. So that first time around 6 weeks, if you find it's not where you want it to be, I would check it again in 6 weeks. Again, the TSH alone is not good enough. You need to know how the gland is responding and how the rest of your body is responding. And is that conversion normal from T4 to T3? So if your doctor will not check it, know that you can do your own ordering of your own blood work online. And you can do that through 2 national labs. In the US, it's Quest and a subsidiary of LabCorp called Life Extensions. You can go online to either of those 2 labs, order your labs, pay for them online, get your receipt that shows proof of purchase. Then they'll tell you, based on your zip code, where is the nearest draw station from where you live. You present that receipt. Okay, you paid for your labs. They'll draw you. And then they'll ask you, where do you want it sent? Well, you want it sent to you because your doctor wasn't interested enough in knowing it. So don't send it to the doctor's office. It may get lost or misfiled or somehow looked at as unimportant and they can't find it. So you want control of your labs. Always keep your labs where you have control of them and you can send them wherever you want.
Absolutely. And then I'm assuming once you get your labs, keep them in a file on your computer or wherever it is that you do, and then take them to a doctor who is open to interpreting these. And I know, Dr. Vicky, you might be open to doing consults by the phone if you.
I absolutely would. I absolutely would. And again, realize that this is just talking thyroid. That's only one of those four legs of the chair. Your thyroid is talking to your female male. Your thyroid is talking to your cortisol, your adrenal. It is talking to your insulin. Nothing works in a vacuum. They're all working together and balancing with each other.
Absolutely. Now, you mentioned iodine. Are there supplements or things that people can take that are natural? What do you recommend typically? Now, I'm not suggesting that that's what someone go out and do, but what are some of the things somebody should consider when they're approaching a healthcare provider?
Well, again, iodine and selenium are going to help support your thyroid gland, your free T4. Okay. So if you know that you are landlocked or you know there's a family history of thyroid issue and you've questioned whether or not there may be a thyroid issue going on in you, but you just don't know, the first and foremost place to start is, yes, will your doctor do the check? But if all they'll do is a TSH, you can order the other testing, or you can simply assume if you're close to one end or the other of that reference range, that you may likely benefit from having iodine up to 600 mcg or selenium up to 200 to 400 mcg in your system. Many times they're part of a multivitamin. Many times you want to have them separately as just an iodine, selenium separate, or sometimes you'll find it together in one thyroid supplement or, one vitamin, quote unquote, for the thyroid.
Okay. And what about, if I've heard of Lugol's iodine drops?
Which
Do you
is
know
liquid
about those?
iodine. That's liquid iodine. So again, that's iodine. So it's whether or not you need to support the T4 for your thyroid gland. That's your iodine as well as selenium. But if you're going to do one, always do the other.
Got it. Okay. And if somebody has had surgery around their thyroid or on their thyroid, tell us a little bit about that.
Well, surgery is done usually if it's a cyst that they cannot determine if it's benign or possibly changing to malignant. If it is something that is like an ultrasound and they see minimal normal thyroid tissue and it's all Hashimoto and your levels are crazy high, it's unusual, but some doctors may recommend surgery for that. But most of the time, if you take the inflammation down in your body and in your GI tract, you can decrease your antibody levels and you can shrink those nodules. You can actually decrease that immune response and put your body into a remission from that Hashimoto's. But if you've had surgery, realize you have 6 small glands, 3 on each side of your thyroid, that are called parathyroid glands. Those control your calcium metabolism. So sometimes too much pressure from your thyroid enlarging can put so much pressure on your parathyroids that it will throw your calcium metabolism out of balance.
So much to know, as we've said, as we wrap up this fascinating conversation. And just before we do, make sure you consult with a healthcare practitioner. Don't just go off and try and treat yourself. And I mean, get your tests for sure, but talk to a healthcare provider, because what I'm hearing from you, Dr. Vicky, is this is all a very delicate balance. You don't want to just go, okay, well, I'll take that and that will solve my problem. It's in the context, right?
Correct. And you have to trend what these are doing because they do talk to each other. And you're exactly right. You can't just go after one, which is what Western medicine likes to do, and ignore the other three because they will be impacted. And if you are having an antibody or autoimmune reaction, realize that a lot of time that is going to have a lot to do with your food supply and the wheat in your food supply, because many Hashimoto's patients are actually having it from wheat and the wheat seed in North America incorporating DEET into its DNA. That DEET, which now has been banned, but it was banned way earlier in Europe, many people will actually react against the DEET in the wheat seed, not the wheat itself. But they're so intertwined, you can't separate them. So people that aren't certain if, well, my antibody level isn't high enough, I don't have to stop my wheat. They do stop it for a bit. When they go back to it, that may be when they have a GI reaction or a rash, because they've eliminated it from their diet, tried to put it back, and it doesn't work. Their body goes, no, we didn't like it before. We really don't like it now. Yet those same people may be able to have wheat products in Europe because DEET was banned sooner, and so they don't have the DEET there. The upcoming controversy in North America is that Roundup, or the actual chemical in Roundup, is that next chemical that's going to be incorporated into wheat seed. So we keep doing this to our food supply.
And that's glyphosate, right?
Glyphosate.
Glyphosate.
Correct.
Thank you. Glyphosate. Thank you. All right. What would you like to leave people with today, Dr. Vicki?
Take charge. Know your body. Know how it works. In particular, know those 4 hormonal legs of your chair. Get a hold of my books. They talk about, in the last chapter of each book, how to talk to your doctor. What are the blood tests that you need done? But in particular, and Esther, I think I've done this, we have a primer that talks about these 4 hormone groups, which is something that you can just download the primer from Esther's website, and you'll get those 4 hormone groups as well. So
absolutely. So we will have that link in the notes as well. Thank you so much for being here, Dr. Vicki, and for sharing just this incredibly valuable and important information for all of us to know. Thank you.
It's my pleasure.
Thank you for being with us at the Mind Myself podcast today. We know that time is precious and you've spent some of your valuable time with us. We're grateful. If you would like to reach out to our guests directly, the information is below. And if you would like more from Mind Myself, that information is also below. Please visit our website and check out all the information about the different complementary, holistic, and integrative healthcare approaches, information about health issues, more podcasts, tons of blogs, and we even have a community page for you where you could reach out and tell your story safely, or you could ask questions and perhaps somebody else in the world is going through something similar to you. In any case, we're so glad you're with us, and we're doing this because you matter.